Hello and welcome to this show where we'll take a look at how Latin America is facing an uphill battle against the COVID-19 pandemic. My name is Marina Colorado. This unique event has turned the world upside down and has revealed the difficulties that some countries face in order to protect the most vulnerable, such as the indigenous communities, the millions of people working in informality, or the inmates living in poor conditions in crowded prisons. Considered by the United Nations as the world's most unequal region, Latin America is facing now its biggest challenge, fighting the spread of the new coronavirus with already weakened health and welfare systems. Most countries in the region have taken measures to stop the spread of COVID-19, but some were a little slow to respond to the pandemic, and others have yet to take any measures at all. From declaring the state of emergency to closing some borders and imposing nighttime curfews, the majority of the region has some type of population confinement measures, with a few countries like Panama and Peru limiting who can go out to the streets on specific days depending on their gender or on their ID numbers. On the other hand, we have Nicaragua, where the government has not given any orders or placed any restrictions to slow the spread of the virus. Brazilian President Jair Bolsonaro has fought his own governors against quarantine measures imposed on the country, and Mexico, after a slow start, finally asked its citizens to stay home. Our journalist Cesar Rojas has more on the countries that have taken a more flexible approach to fighting COVID-19.
A handshake between Mexican president and the mother of drug lord Joaquin El Chapo Guzman. It's all it took, not only to offend many, but also to reflect how little attention had Andrés Manuel López Obrador given to the social distancing measures recommended by international health officials.
Es una señora de 92 años.
She's a 92-year-old woman. Like I said, corruption is the real plague here.
La peste funesta es la corrupción.
Not an elderly person who deserves all my respect, regardless of who her son is.
Todo mi respeto, independientemente de quién sea su hijo.
On March 22nd, López Obrador asked Mexicans to continue going out and eating at restaurants. A day later, the country started phase 2 of the COVID-19 containment. Finally, a week later, the president asked citizens to stay home. In the meantime, Brazilian President Jair Bolsonaro contradicted his health minister, a clear advocate of social isolation, and said he went overboard and lacked humility in his response to the crisis. He also encouraged people under 40 to keep on with their lives and jobs.
The collateral damage brought by the measures to fight the coronavirus should not be worse than the actual illness.
The slow response could have serious consequences, as seen in Italy or Spain. With new cases and mortality on the rise, the presidents of Mexico and Brazil are starting to take some steps, but at their own pace. This, however, is not the case in Nicaragua, where Daniel Ortega's government has yet to take any steps against the virus. For the time being, citizens have started to protect themselves and to self-isolate. Rosario Murillo, the First Lady, who is also the Vice President, called Sandinista followers for a massive rally named Love in the Times of COVID-19. All this while her husband, President Ortega, has not been seen in public for several days.
The decision to impose isolation measures or curfews has bigger impacts on some citizens than others. Informal workers who live off of what they earn each day are some of the most affected. Daniela Blandon has the details.
Mayra Ramirez's pockets feel lighter than ever.
Business has gone down a bit. I'm selling about 10 newspapers. Before I used to sell 100 every day, so my earnings have decreased at least 80%.
She has spent most of her life selling newspapers on the busiest street of Guatemala City. Now, because of the curfew, her working hours have been halved. The scenario in other countries is even bleaker.
I've worked on the streets my whole life, and I've always been able to bring food, medicines, everything to my kids. With what's going on, I can't even go around the corner. I don't have a job.
An informal worker is someone who depends on daily earnings to be able to eat every night. And although they have food on their tables, the UN's International Labour Organization emphasizes on the fact that most of them live under poor sanitary conditions and do not have access to quality healthcare. The rate of informality varies from country to country. It can go from 30% of the workforce to as much as 70%. This means that about 5 out of 10 workers in the region are in the informal economy. Some governments are implementing emergency programs to face this problem. These include unemployment benefits or some other type of compensation. The coronavirus threatens to make things worse in the labor market in a region already considered by the UN as the world's most unequal.
Let's now take a look at other issues on this fight against COVID-19. The new coronavirus also threatens the indigenous communities, which represent about 10% of the population in Latin America and have historically been more vulnerable to imported diseases. In Colombia, Brazil, Peru, and Ecuador, they have decided to isolate themselves. In Argentina, on the other hand, they fear they won't be able to face this new threat, in addition to food shortages. While most people try to practice social distancing to avoid getting infected, inmates in overcrowded prisons have no choice. The lack of space and unsanitary conditions spurred riots in Colombia, Argentina, Brazil, Venezuela, and Peru that ended with at least 40 dead people, dozens hurt, and hundreds on the run. Authorities seek urgent measures to prevent a health and human disaster. And the western part of Ecuador has been the worst hit in the country. The port city of Guayaquil, which happens to be the most populated, is going through a health crisis. The funeral homes and morgues are overwhelmed, and Ecuador's government has begun storing bodies of victims of COVID-19 in giant refrigerated containers. Moving on now to Venezuela, a country that faces the pandemic with an already strained sanitary system, water and energy shortages, and a drop in global oil demand, which represents more than 90% of Venezuela's export revenue. Now, on top of the virus, the country deals with new pressure from the United States. The Trump administration accused President Nicolás Maduro of drug trafficking and offered $15 million for information leading to his arrest. The U.S. then sent military ships and aircraft to the region and offered to lift sanctions against Venezuela if a transition government is formed without Maduro in it. And this pandemic is only one of the many diseases being dealt with in Latin America. Since 2019, the continent has seen a surge in dengue fever cases. The region wonders if the new coronavirus will collapse an already strained healthcare system.
Latin America is worried about the increasing amount of coronavirus cases. But there has been another epidemic silently battering the continent since 2019, dengue fever. The virus has already put a strain on the healthcare system of several countries, and some question the ability of many nations in the region to efficiently cope with the impact of the new coronavirus, while at the same time dealing with dengue cases.
We've had more cases of fever reported in health centers. Since then, and to cover the demand, doctors have been doing double shifts. Lab technicians and nurses are also working double shifts.
In 2019, there was a six-fold increase of cases compared to the previous year. 3 million people were affected. Brazil has the highest number of cases. But on a per capita rate, Central American countries such as Nicaragua, Honduras, or Guatemala fare worse. The lack of resources and preventative actions doesn't help in the battle against dengue.
Ellos sabían desde el año pasado.
It's been a year since they know about this problem, and they haven't taken any action.
Tomaron las acciones en forma oportuna.
This disease, contrary to the urban COVID-19, is more prevalent in rural areas, but it is spreading more rapidly thanks to global warming, which allows mosquitoes, the sole vector of dengue, to thrive where they once could not. Now, to the years-old battle against dengue, Latin America will have to add the challenge of fighting the new coronavirus simultaneously.
But not everything about the pandemic is negative. In several Latin American countries, a few initiatives have emerged, and many are especially aimed at helping health workers.
Jorge lives in Buenos Aires. He didn't know what else to do. He was becoming desperate in isolation. But then he found in a 3D printer the perfect way to channel his energy. He started making this face mask that help protect against the fearsome respiratory droplets that can transmit the coronavirus. Following the example of countries such as Spain, he organized a network of volunteers that distributed 500 masks in 20 hospitals in their first week.
The demand was huge. The phone was ringing all the time. Nurses, policemen, private security guards, they were desperate.
In neighboring Chile, the company Codelco also uses 3D print technology to make masks made out of copper, a material whose properties allow it to repel bacteria. Meanwhile, in Mexico, those who don't have access to the same kind of technology try to help in their own way. These women chose to give birth in their own homes in order not to overload hospitals. In this time of pandemic, we must not let anyone behind. That's why the Chepe Se Baña NGO in Costa Rica transformed this van into a portable hand-washing sink that travels the streets of San Jose. It specially visits the most vulnerable areas, not forgetting those for whom water is a luxury.
And this is it from us at the studios of France 24 in Bogota, Colombia. Thank you for watching. Stay tuned and stay home.